we're looking at what is total triage, actually what it means in practice, and actually what that looks like as well. How Wilmslow Health Centre found it, so that's on you, Amar, and your experience in talking to that as well. And also, how can Accurx help and the support that we can give and offer also. We've got some questions available to you to ask, so you can fill up the Q&A box. I've got my colleagues on the line also who are going to be typing away and answering you, so don't feel like you have to answer it or ask it live. We absolutely will be sending you the recording after this as well, including the slides. So I'll make a couple of points of reference here because we've got resources towards the end. So any links and things like that you might need, that will be sent out to all people who've registered. So if you need to drop off at any point, don't worry, you'll get the recording after regardless. First up, total triage. It just means that digital access can be promoted and that practices find requests can come in any way as they typically would. So patients can still walk in or they can call, and you'll be able to record these in the same way as any patient who's submitting that online using Accurx's reception flow. And I'll talk a little bit more on reception flow a bit later on, because that's really the cornerstone of everything to do with total triage. And that's the kind of first step in that move towards it largely. This also, just by using this kind of system and making sure that everyone is being treated in that same way and same process, it does encourage patients to go online and complete that standardized form, and every patient is having that experience. So it's really trying to support timely and appropriate care and care navigation, as well as that equity of access. A really common question we get here, particularly around total triage, is what about patients who maybe are at risk of digital exclusion, who can't access things online? And it's a really valuable point, and definitely something that we want to touch on, which is where reception flow really comes in and comes to the fore. So with reception flow, you can improve that patient access to care by ensuring that anyone who potentially can't get online can still submit a request through that same format and that same workflow. You can funnel all of your requests into the same inbox, treating patients equally, triaging them based on clinical need, and not necessarily booking appointments just for whoever contacted first, or maybe was first in the queue at 8 AM. This feature is called reception flow, but it's definitely not just for receptionists. And I'm going to show you what it looks like, so anyone can use it, and you can do it along with me now as I do a quick demo. So if you're interested, please do follow along. First things first, as you'll see here, and I'll make sure to send this to everyone who's registered after this webinar. This is just a quick interactive demo as to how you can actually begin to do that reception flow. So you can bring up a dummy patient in your clinical system, whether that's EMIS or in System 1. And once you've got them up there, you can go back to your Accurx inbox. And you'll be able to see the patient's name in the bottom corner here. Now you can select the type of request that patient's making. Have a look at any red flag symptoms. So anytime the patient's getting in touch with the practice, they're confirming that they don't necessarily need to get to 111 or A&E immediately. Describing the medical problem. So the same thing as what the patient is seeing on the online form. So they can put in the relevant details here. And once the form is complete, you can click continue. You can select whether the person who's either calling or in person is actually submitting this on behalf of themselves or on behalf of someone else, like a family member. And you can then click continue. You can ask for a preferred contact method, and you can pre-assign this to a team. So by default, all of the patient triage requests go to the to assign folder. But if you want it to go directly to an individual team and that folder for them to access, then you can do that through here. Once you've submitted the request, you can review all those details, then you can head to the inbox to take a look. That's reception flow as we know and love it to be. Again, I'm going to make sure that I share that interactive demo with everyone so you can have a play around with it. You can do the same clicking as I've done. Also, you can bring up a dummy patient and give it a go yourself as well. Go back to my slides. And now, Amar, the spotlight is very much on you, the star of the show for us today. And the first question I've got for you is, just if you could tell us a little bit more about your experience and the journey that Total Triage has been for you so far.
Yeah, so we obviously we came across Accurx 2018, 2019. We were one of the first to use the texting SMS texting function, and then so we made great use of that, especially during the pandemic. And then during the pandemic, we felt that that would be the right time to move to a total triage system, because we were getting a heck of a lot of demand, and we just needed a safe way of making sure that all the people waiting to get an appointment weren't waiting with something that really needed immediate attention. So that was our primary concern. And so we were approached in the summer of 2021 to see if we could help with a pilot. And I mean, we jumped at the chance, and Accurx and a few other practices and us, we've all been feeding into the same pot and developing a system which is built around real general practice rather than what a developer thinks general practice should be like. So that's where we've come from. That's why we've stuck with patient triage. And we've got 16,000 patients. We've got a really fast growing list size. It's going up by 1,000 each year. We've got the same challenges that every other practice is facing up and down the country: unlimited demand and limited capacity.
Do you think there's any more perhaps niche challenges that your practice faces, or do you think it is that central thing of you feeling kind of under pressure and that extreme pressure there?
Yeah, it is totally about keeping, first of all, I know, patients safe, but also your own staff safe. To us, that's always been a primary concern. If you haven't got a happy, healthy staff, then actually patient care suffers. And the demand in the NHS free at the point of delivery system is actually unlimited. And I think we've just got to accept it and find ways just to mitigate it until we come to a better way of doing primary care in this country.
And if you cast your mind back to before Total Triage, so perhaps before you necessarily even started with online consultation, what was that like? And then how has that kind of changed since?
So it was very much, we had that 8 o'clock rush as well, although it wasn't as bad as in some other places. And it was basically the people with the sharpest elbows and those people who shouted loudest who would get the appointments. And sometimes, patients who were really in need were waiting inordinately long times, we needed to change that. And that was also having an effect on morale, effect on clinical morale, receptionist morale as well. And now this is just a way of simplifying the process and making sure that the limited slots that you have got go to the right people.
And do you find it difficult making those decisions? So when you're doing that triaging and you're seeing all of those requests there, what's that process like?
So in actual fact, for most of the week, it's actually made it a lot easier. The crunch points come on a Monday morning or after a bank holiday weekend. Obviously, you're just inundated on those days, but it's still manageable. It's just made it a whole lot less stressful for us, because we know we can actually efficiently direct a lot of those requests now to R's roles, to pharmacy first, so that they never actually see the GP surgery, which they didn't need to, so that we can now concentrate on our patients who are genuinely ill, and the elderly and the cancer patients, all the ones that we really need to get to quickly.
Yeah, that makes a lot of sense. And what's your feedback been from patients, and has that varied depending on the demographics? I know that's a big concern for all practices, that maybe it's just young people who will actually be enthused by something like Total Triage.
No, not at all. So we've got an elderly population, we've got young families as well, so we've got a huge mix. We've got very affluent down to areas of severe deprivation. So the feedback's been amazing. A lot of it is unsolicited. If you go on our Google reviews, it's we're taken aback by some of the feedback there. So yeah, it's not going to be a panacea. It's not going to cure the woes of the NHS and primary care right now, but it's a way of making it easier for your staff and for your patients.
That makes a lot of sense. And then maybe perhaps more like about how the actual workflow works. How is that set out in your practice in terms of when the request comes in, who's
Yep.
making those decisions, and what role is where?
Yep. So psychological safety first, really, really important. So you need to have a way of turning it off. And we've decided that we turn our system on, the triage system, from 8 o'clock in the morning and we turn it off at 3:30. It's never on overnight, and it's certainly never on over the weekends or bank holidays. So psychological safety first. And then the triage requests come in, and they are then filtered by the receptionist, or care navigators as they're called these days. The ones that need to be triaged are put into a clinical triage box, which is monitored by the on-call GP. And we purposely keep the request triaged by experienced clinical staff, because that works best. Yes, you're taking them out of a surgery, but actually you're saving a heck of a lot on slots, because an experienced triager is able to absorb more risk and is able to triage much more efficiently and much more effectively and point the patient into the right direction.
And do you think, in terms of that approach, do you think this is like a one model fits all potentially, and that actually you can replicate that in any practice? Or do you think that perhaps Total Triage has to be amended and changed in a way that suits each practice as well?
So yes, I think you do need to tweak it for every practice, and we constantly tweak ours, and we constantly tweak the ratios of our different types of slot. So that's essential. But we've run a lot of seminars, and we've helped tens and tens of practices around the country, from all over the country, with different demographics, and they all seem to make it work. It's not rocket science.
No, that's great. And I know I've taken a bit of your time, and I'm conscious I want to speak a bit to the questions that have been asked in the chat to you. So I've got one here, which is, hi, Dr. Ahmed, do you have any advice on getting ahead of being too accessible? We sometimes get multiples a day from many of our patients because we are quick and fast. We have
Absolutely.
a similar list size to you.
Yep, I completely get that. And actually, especially when you launch the system, you can actually feed demand. So your demand goes up for a little while and then starts to dip down. For those people who are using it a lot, we do keep an eye on that, and we have meetings with those patients to see exactly why they're using it that much. And actually, we also have contracts with certain people as well to make sure that we make sure that every one of our 16,000 patients gets equal access to the very limited resources in primary care.
That makes sense.
And the other thing that you can do as well is don't reply immediately. One of the great things about Accurx is that you can delay the responses. So all you're doing is, if you're getting an immediate response from a very efficient service, is they'll shoot off another one and another one and another one for their parents and their grandkids and whoever. So we've just got to be aware of the kind of healthcare system that we're working in, and it's not like the rest of the world where we're touting for business.
Brilliant, thank you. And there's another one here, which is, I monitor the inbox. I'm not clinical, so I just pass to the same day duty doctor. Is there a better way of doing this?
Well, that's so we've found that if you've got non-clinical staff triaging, then it doesn't work as well. And we find that the clinical staff are able to really categorize those slots into the types of slots that we've got in our practice. We rag rate all of our slots. So the red ones that need to be seen immediately, they are if you go onto our website, I've kind of explained it all. We kind of gamify our system to make sure that there's a incentive for the doctor triaging to triage effectively. And I think if you look at the Wilmslow triage system, look it up on Google, that will explain how we actually do our rag rating, and that works extremely well.
And then do you utilize any other Accurx products in that kind of process, or is it just kind of focus on the online consultation, or is there florries that you get involved?
Oh,
Things
absolutely.
like that
Yeah.
as well.
So when you're responding to patients and asking for more information, we use florries, which are now called clinical questionnaires now, aren't they?
Yeah.
So we use those a lot. Most of the requests that come in actually you don't actually need further information. You're able to triage them very, very quickly. But the few that are appropriate, you do uh, send off. For instance, a UTI. I mean, these days I'd send them to pharmacy first, but if it didn't fall into their remit, then you'd send them a clinical triage, a good clinical questionnaire, and get the results back. And those are, for us, they're one of the few kind of situations where you can deal with it completely by text.
But would you say the majority of them actually aren't being dealt with completely by text? So are they
No,
still resulting in appointments almost?
well, a lot of them are farmed off elsewhere. And we also have defaulted to face-to-face. That's very important. We defaulted to face-to-face very, very early on, and we've actually found that reduces demand as well. It's sad to say, but if you are too accessible and you can call from the beach in Bognor, people tend to do that quite a lot, and you get overwhelmed with demand. So we found that our clinicians prefer face-to-face. We find it's clinically safer. I feel more comfortable seeing them face-to-face, and the patient, has to come in and then see you.
Yeah, that's actually a really interesting point to touch on, I think, because a lot of the feedback that we can get around online consultation can be, well, patients actually want to be in person more, they want more face-to-face appointments, and that's quite a good solution for you to say, well, actually, you can get in touch with us, but if you want this appointment, then we'd expect you to come in and to have that conversation to give you the best care.
Yeah, and I think, by doing it in an organized fashion like this and triaging everything, that's enabled us to, for instance, in 2023, we delivered 75,000 appointments and 84% of them were face-to-face. So, it just makes it a little bit more efficient. But, the aim isn't to run faster and faster on the treadmill. The aim is to deliver safe, effective care whilst preserving your own sanity.
Brilliant. And there's another question that I've got here, which is, you mentioned reception staff decides if the request needs to be in triage pools. Does that mean they can book directly to the slots if appropriate?
No, absolutely not. Never let anyone book into those slots themselves. Even doctors who need a follow-up appointment with a patient, they must go through the triaging process as well. Those slots are really valuable. If you start letting access to those slots by anyone willy-nilly, they'll get booked up, and your system will collapse because it relies on having slots to triage into. And if they've all been used up with silly little things which don't really need an appointment, then that's disastrous. So yeah, those are guarded by the on-call GP.
It's kind of sacrosanct. No one can touch them.
No one can touch them. Absolutely.
That makes sense. I've got another one here, which is, when the on-call GP does the triaging, do you respond back to patients? Oh, wait, no, we've already done that one. Sorry, too many questions up here. So then we've got another one, which is, how far ahead do you book your appointments?
Okay, so that can vary from the time of year, but so we've got our three categories of slot. Our green slot current wait time is coming up to a month, which is unusual. It's usually, for a routine appointment, it's usually around 2 weeks actually in the normal time of the year. In winter, it can approach 3, and now it's I don't know if everyone else is really busy, but we are.
Yeah, I think that's a resounding yes, I think, for everyone and people that I've spoken to, certainly.
Very important.
It's interesting, because I think that the main concern here is that total triage is the thing that may cause unlimited demand. But in your answer, almost, it seems it's not necessarily, it's actually a factor to really mitigate against that. So it'd be interesting to explore that a bit further.
Yeah, so this is a really good way of handling the unlimited demand, but it relies very much on being able to turn it off and being able to give your staff enough time to catch up with some of the requests that you've got already. If you leave it on, And some practices did this in the early days. They left it on overnight, and they came back to 1,000 requests in the morning on a Monday morning, which was just impossible to deal with. So there's got to be a limit there. And I personally, if it came to us having to leave it on until 6:30, then I'd very much question being able to work in the NHS anymore.
I think it's such a really big and valid concern that for GPs and for primary care, and it's primarily around that capacity and the risk of overwhelm from patients.
Yeah.
But it's also, as you said, that there is almost that unlimited demand, and that doesn't go away.
It's not almost unlimited. It is unlimited demand.
It is categorically unlimited.
Absolutely.
And that doesn't go away if you close down access in that sense. But by making it as open as you can in the hours that you can, which you have done at Wilmslow, then I think I doubt, what do you think that impact would be on the patients? Or do you think they're concerned that the form doesn't close until?
Have a look at our Google reviews. Everyone's happy. The patients love it. If you leave it on overnight, for instance, we had lots of requests from drunk people, and at 3 a.m, or people ruminating about some health concern they've read about. It doesn't work, and all you will be doing is encouraging even more demand. And yes, it's great that in an ideal world, yes, you can have your GP accessible 24 hours a day, your own personal named GP, but we haven't got the capacity to cope with that right now. And really, primary care is on its knees, and that's what the ballot's all about. So I would say one of the reasons, and even when Accurx didn't have the ability to turn it off, we programmed our website to turn off the link during certain times, because I think that is absolutely essential to the safety of your practice and your staff.
I completely agree, and I think it's a really good one to reinstate almost, to say that there are things in place where you can actually begin to pull back and levers to pull in terms of managing that capacity, so it isn't this highway of all that traffic coming at you.
You see, in the old days, there used to be I mean, we've got to admit we live in a rationed healthcare system. I think everyone who's sensible acknowledges that. And the way we usually ration healthcare in this country is through waiting lists, through wait times on the telephone, and those kind of mechanisms, wait times for appointments. And when you've got an online system like this, you've kind of removed one of the mechanisms of rationing, which it causes chaos in the system. But having said that, if you're able to turn it off, it will work extremely well. And that's why we've advocated patient triage at our place since 2021. We wouldn't never go back to another system because it works brilliantly.
Fantastic. Okay, good. I'm going to do a quick change of topic, which is looking back to the early days of this project. How many receptionists were you using for taking phone calls?
So we've even since the early days, we've got so we've kind of reorganized the way we function as a practice. We've got one room where a receptionist sits with a GP with an admin person as well, which is very adjoining a coffee room. So it's all very much we work as a team. So we've got that one receptionist working with the GP, and that's worked all the way since 2021. We haven't needed to increase that just yet. The only thing that we are thinking about is on a Monday morning is maybe increasing that a little bit, but the actual crunch point comes with the GP triaging. We might need 2 GPs triaging on a Monday morning if things continue as they are.
And if the demand was as it is currently, but you didn't have total triage in place, how would that feel?
Again, it would be back to the bad old days where you'd have irate doctors, quite rightly irate patients who are waiting inordinate amounts of time for some serious health conditions. It was every man for himself. It was a Wild West, and this is just a way of saying to some patients, actually, yes, I know that you want to be seen, but your request has been assessed by a GP, and we feel that it can wait a couple of weeks, and that works really well. And it's just a way for you to push back a little bit, and to train patients as well to use self-help. and to train patients to go to the numerous other roles who are there to help them now.
And I think patients panic because they think, oh, well, if I can't get access,
Absolutely.
I need the appointment. I don't know if anyone's going to see me. I just want to speak to a GP. It's like a resounding kind of comments that come up again and again.
So there was a lot of failure demand in the system before we instigated this. It's demand generated by a collapsing system and people panicking and just booking. We had people booking slots just in case their child was unwell before the Christmas weekend. You know, it was crazy. So even though access wasn't really a massive problem for us, but that's the kind of stuff that was going on, and we've been able to sweep all that aside now.
Yeah, no, that's fantastic. There's another question here, which maybe is just kind of your thoughts on it, which is, did you engage with your patients before you moved to Total Triage, and how much did you kind of spread the word and things like that as well?
We did a little bit, but you don't have to overdo it. We had word with our patient participation group, and we trialed it for a few sessions, and then we just did it actually. And you know, you're going to get a bit of pushback. Why can't I just book an appointment? Why can't I just call up and book an appointment? Why can't it be like it used to be? But when they see how it works and how easy it is for them, they're soon placated and they get on with it.
And at that point, when those patients were saying those things like, why can't we just do this? Was there any temptation to kind of pack it all in and just go back to a previous system?
You will always get that person in the practice who will say, oh, no, look what you've broken it. And, you know, why can't we go back? And there's a lot of pressure on you, especially at times of crisis. And there will be to go back to the old ways. But no, as far as I know, all the practices we've helped as well, they've stayed with it, they've stuck with it. That initial period is hard. And that's why, you know, we try to advocate not doing it during winter. Now's about the right time to do it. Maybe after Easter, probably better. But yeah, you just need to be ready to hold your nerve.
Well, ready and prepared.
Yeah.
I'm gonna stop grilling you now after that relentless questioning.
Right.
But thank you so much for coming on, for speaking, and I'm sure that people in the chat are very grateful. I'm going to move on to a couple of additional resources that we've got here, just talking about Total Triage, and particularly in terms of maybe even sharing with patients or being ready and prepared, as you said, Amar. So we've got a comprehensive training guide. This covers everything that you might need to know in terms of implementing Total Triage in your practice. We've consulted Amar as one of them, but there have been lots of people who've come, chatted to us, and spoken, and we've put everything together and made it into a training guide. We've also got calls with our GP partner ambassadors, so you can book into a call there if you need some additional training. We've got patient-facing materials. These are things like posters, YouTube videos, that also cover that. And then we also have implementation training calls. So that's the team that I'm in, so the implementation team. So you can have a one-to-one call with any of us. I've done 300 so far, so it's going up and up, and we keep speaking to new practices, getting new information and seeing how they're working it out. So we would love if you wanted to book in for a call with us. I'm going to send you this information with these slides and with the recording. But if you want to look right away, you know, Amar's inspired you so much, then you can just use this link that's at the bottom of the slide here, which is www.accurx.com/total-triage. And it's got everything there, and you can kind of move your way through it and download all sorts of different things. For any kind of questions or additional questions that we weren't able to touch on or cover today, first, we've got that Total Triage Help Centre that's got a whole bunch of FAQs. We've got our email address, customer.success@accurx.com. So any kind of training, any further materials that you might want, please do pop us an email. And then also, if you don't have access to patient triage already, but you would like to, go to partnerships@accurx.com and have a chat with one of our lovely partnerships team. But other than that, that's it for me today. Thank you all so much for coming, and keep an eye out on your email for the recording. Thank you, Amar.
Take care. Bye now.
Bye.